Well, good afternoon. We're all playing a part in the fight against this virus. And as I've said before, this virus doesn't stand a chance against our army of 14.5 million people. And for the majority of Ontario, for most of us, fighting this virus means staying home, isolating, stopping the spread. But for the frontline heroes, for our brave men and women leading the charge, fighting against this virus, fulfilling their duty means something entirely different. For those on the front lines, for those looking after COVID-19 patients, for those working in our long-term care homes, for those caring for our most vulnerable, and for those working in close quarters, maintaining order in our correctional facilities. For these heroes, getting up every day, getting back in the fight, getting back to the front lines comes at a great price. It comes with a personal sacrifice. Nevertheless, every day, these brave men and women show up. They take their post at every long-term care facility, at every retirement home, at every hospital, at every group home and shelter. They work 12-hour shifts or more. They take risks day in and day out. They do this to look out for us. And as Premier, it's my job to look out for them. That's why we've done everything possible to protect them, to give them the tools and resources they need. And today, we're recognizing their incredible effort. We're recognizing their sacrifice. As of April 24th, our nurses, our personal support workers, our long-term care staff, our home care workers, our hospital staff, our staff at homeless shelters and women's shelters, and those looking after adults with developmental disabilities, our correctional officers, our cooks and cleaners at these facilities, they will receive a $4 per hour pandemic pay premium for every hour of work they complete for the next 16 weeks. On top of that, those who work over 100 hours per month will receive a $250 bonus per month for up to $1,000 over the next 16 weeks. For a full-time PSW, cook, cleaner, nurse, that means about an extra $3,560. It's our way of saying thank you to over 350,000 frontline long-term care workers, healthcare workers, and other frontline staff. This increase will also help our frontline providers attract and hire extra staff they need to continue taking care of patients and residents during this unprecedented time. And I want to thank the federal government for their support in making this possible. I was on the phone yesterday with the Prime Minister and my fellow premiers. The situation we're all facing is unprecedented, and it's extremely serious. And this crisis has clearly shown the deeply rooted, long-standing cracks in our long-term care system. We need to do better, and we will do better. The federal government has been a tremendous partner to this point, but we really need them to step up. We need a sustained commitment on health care and long-term care from the federal government. We need them to do their part when it comes to protecting the most vulnerable in long-term care homes, because we have a collective duty as a country, as a people, to protect the most vulnerable, to look out for each other and have each other's backs. And together, we will get through this. We will learn from this. We'll emerge stronger and more committed and more united than ever before. I want to thank you, and God bless the people of Ontario. Now I'll send it over to Minister Bethapalvi.
Well, thank you, Premier, and thank you all for joining us today. And I want to thank my many colleagues, some of who are standing right behind me, and the officials who've worked tirelessly 24/7 to make this day possible. Throughout this unprecedented crisis, we have remained focused on one thing: protecting the health and well-being of Ontarians. And we know that the healthcare heroes and frontline workers who are keeping our province going face unique challenges, including increased risk of exposure to COVID-19. But despite these challenges, they are doing extraordinary work. That's why, today, our government is announcing a new temporary pandemic payment of $4 per hour worked, over and above existing hourly wages, for the next 16 weeks for those on the front lines fighting COVID-19. C'est la raison pour laquelle aujourd'hui, notre gouvernement annonce une nouvelle rémunération temporaire à la pandémie de $4 par heure travaillée, qui s'ajoute au salaire horaire pour la prochaine 16 semaines des travailleurs de première ligne qui font face à la COVID-19. We're also providing a monthly lump sum payment of $250 per month for those working over 100 hours every month for up to 4 months. Nous offrons aussi un paiement mensuel unique de $250 par mois aux travailleurs qui font plus de 100 heures de travail par mois pour une durée maximale de 4 mois. This means that eligible employees working an average of 40 hours per week would receive $3,560 in additional compensation. In total, over 350,000 employees across Ontario will qualify for this wage enhancement, including frontline staff working in long-term care homes, retirement homes, social services, congregate care settings, including emergency shelters, those providing home and community care, and some staff in hospitals, and staff working at corrections institutions. All eligible employees will be able to receive the temporary pandemic payment whether or not there is a COVID-19 outbreak in the facilities they work in. Partnering with the federal government, we are making this significant investment which will last for 16 weeks. The pandemic payment recognizes the valiant efforts of our frontline workers in the fight against COVID-19. These heroic workers are delivering critical services that support all Ontarians, including the most vulnerable members of our communities. They often put themselves and their loved ones at risk. They are saving our lives, and we owe them an incredible debt of gratitude. Long-term care homes and other congregate living facilities are the epicenters of this pandemic. In my riding of Pickering-Uxbridge, we're seeing this firsthand. And in response, frontline staff at these facilities are taking up the call and putting themselves in harm's way daily to help the most vulnerable. My gratitude and my heart goes out to them. These workers have answered the most important call of public service to protect and care for those in need. I would also again like to thank the federal government for working with us on this and so many other important measures in the fight against this pandemic. Je tiens à remercier le gouvernement fédéral qui a travaillé avec nous sur cette mesure et sur de nombreuses autres mesures importantes visant à lutter contre la pandémie. This time-limited, 4-month program reflects the extraordinary challenges posed by COVID-19. But more importantly, it reflects the extraordinary response to those challenges. Our government remains committed to using every resource we have to support frontline workers as we work to stop the spread of COVID-19. Thank you all for your time today, and to all the workers of the front lines. Thank you for everything you do. Merci beaucoup.
We'll go to the phone line for questions. First question.
First question comes from Douglas Boyd from Rogers TV. Please go ahead.
Good afternoon, Premier.
Good afternoon.
I asked you back on April 11th about GM and Oshawa, about making medical supplies. Yesterday, GM announced they will be making medical supplies, face masks for Health Canada. Just your reaction to that.
Well, I want to thank GM, what a great company, along with other auto part manufacturers and automotive manufacturers as well. You know, that's the true spirit of Ontario. They're stepping up, they're helping out, And hundreds and hundreds of companies, if not thousands, have stepped up and they've retooled and they're supporting the cause, and everyone's pitching in, and I'm so, so grateful to all the 14.5 million people in Ontario, and as well as our great companies. I've always said, Douglas, that we have the greatest, brightest, smartest people, best ingenuity anywhere in the world. And when you can switch over this quickly as some companies have and retooled, that's the difference. That's why we're going to, in the future, never rely on any foreign country or any foreign government or leader to dictate our supplies when it comes to PPE. So again, GM, thank you. Thank you for stepping up and doing an incredible job. Thank you so much.
And also, Premier, can you tell us what the role the Army will be playing in our long-term care homes? And for Peter Belsalby, his reaction, what happened in Pickering?
Yeah, well, I'm just so grateful for the Army and General Vance, and I know I've said it a couple times, but I'll say it again. When I talked to the General, he said, Premier, send me into the toughest homes there are. You have to just love the men and women that serve our country, willing to do anything, help us out. They're true champions. I'm gonna just send this over to the Minister of Long-Term Care. Thank you.
We're incredibly grateful for the federal support in terms of actioning our military to come and assist in our homes. And we know that the staffing issues were predating the pandemic, but have become more acute because of the issues surrounding infection and COVID-19 even in the community. So that has impacted our long-term care homes.
Peter.
Okay.
Well, and thank you for asking the question about Pickering, Uxbridge, my riding, my community. It's a heartbreaking, and many families and constituents reached out to me, and I talked to all of them, many same day, and I will continue to. No ask is too great, whether it's to get the hospital into the facility through a public order through Durham Health, or bringing the military in, to someone asked me if I could help get an iPad in there. And I said, well, I'll check with public health, but I'll do everything I can. At the same time, I've come to know a lot of the frontline workers, and the other day I was at a part of a motorcade at Ajax Pickering Hospital, where over 400 cars came out. We drove by the hospital, thanked the frontline workers, and it was very emotional, because as I was driving by, I was waving and smiling, and they were smiling and waving back, taking pictures. And I thought, well, I choked up, because it's backwards. We're there thanking them. But you realize it takes a community. It's hit us hard, and we'll do everything we can. And as the Premier has said many times, we're going to do everything we can, and we'll continue to do that. Thank you.
Next question.
Next question comes from Kari Verma from CBC National. Please go ahead.
Good afternoon, Premier and Ministers. Last week, we heard from this very press conference that hospital staff were going into select long-term care facilities. So what's new about the emergency order to redeploy staff announced today? And just like with today's announcement of paying PSWs more, why weren't these measures announced weeks ago, when we only had a handful of outbreaks, versus now where there's over 100 long-term care facilities with COVID outbreaks? And specifically on the question of pay, about a month ago I asked Minister Elliott why the province wasn't considering this, so what has changed?
Well, before I pass it to Minister Elliott, we needed the flexibility to have hospital staff go in and support us at long-term care. As for the question why we didn't increase the pay earlier, I wish I could increase the pay right from day one. The government didn't have the capacity at the time, and I want to thank the federal government. They played a massive role in stepping up and helping us. So they put the program together. We've put money in. The federal government's put a tremendous amount of money in. And again, I just want to thank them. And I'm going to be over at long-term care today to personally thank the frontline healthcare workers that Carla and I are going to go see her mom and talk to her through the window. And, you know, we'll be thanking the long-term care workers. I'll be leaving right after this press conference. I'm so grateful for the people out there that are working day in and day out. They deserve every single penny times 10 if we had the capacity, what they're making. And we just want to show a small token of our appreciation for the hard work that they do. I'll pass it over to the Minister of Health.
We're extremely grateful for the work that has been done by many hospitals voluntarily with going in to help people in long-term care homes, to help staff up, to help with infection control and prevention, cleaning and everything else that needs to be done. But what we found that while this was happening gradually, it just wasn't happening quickly enough to get the numbers of people that we needed into our long-term care homes immediately. There's several thousand people that are required in addition to the armed forces staff that are coming forward, in addition to the numbers of people that have come forward with our workforce matching portal. We simply needed more people there. So we did speak to the Hospital Association. They understand why we needed to do it. But I also spoke with the employee organizations, with Ontario Nurses Association, with SEIU and other groups to speak to them about this. And without hesitation, they agreed to this, knowing that there is a need in our long-term care homes. They want to help these very vulnerable citizens as well. So it's a great example of teamwork among the hospitals, the employee organizations, working with us in the government, with the Ministry of Long-Term Care and the Ministry of Health. So that's how we're going to beat COVID-19, with everybody working together.
We can just remind each reporter you have one question and one follow-up. Next question.
Next question comes from Brandon Gomez from CP24. Please go ahead.
Hi, Brandon.
Hi, Premier. Brandon Gomez here from CP24. We've been noticing that the trend, and what we're hearing from politicians across this country, is that things are slowly getting better in terms of the situation, because people are socially and physically distancing and listening to government officials and as well as public health officials. But currently, right now, outside of Queen's Park, where you're located, there is a protest with about 100 folks who are calling for the end of the lockdown here in this province and across this country. What message do you have to people who are not taking this seriously, but also who could be not adhering to social and physical distancing protocols?
Well, that's a great question. You know, when I looked out the window and we see these people that are absolutely irresponsible. It's reckless to do what they're doing. And personally, I think it's selfish. We have healthcare workers down the street at these hospitals working around the clock to protect the community. 99.9% of the people in this province are working together, side by side. That's the reason we were able to see a flattening of the curve. But then we have, you know, a bunch of yahoos out in the front of Queen's Park sitting there protesting that the place isn't open, as they're breaking the law and putting everyone in jeopardy, putting themselves in jeopardy, putting the workers in jeopardy, and God forbid one of them end up in the hospital down the street. You know, we're better than this. We're better than this as a people, as a province. We've proved it. And, you know, then you have these people that want to protest. Hey, I understand that people want to get out there, but we have to be responsible. We have to make sure we've come such a long way that we protect the health and the well-being of every single person in this province. And there's no one that wants to open up the economy more than I do and everyone else, but we're going to do it responsibly. We're going to do it through the guidance of our Chief Medical Officer of Health and consultation with municipalities, consultation with our health team. But we've come such a long way. And then we have these people that want to break ranks with 14.5 million people and just go rogue. Again, it's irresponsible, reckless, and it's selfish. It just burns me up. We work so hard, and we have a bunch of yahoos out there thinking it's all right. Imagine if every single Ontarian resident acted the way they're doing, or what they're doing right now. It would set us back months. That's what they're doing. They're setting us back months by doing these reckless protests. I don't even know who these people are, but obviously they don't care about everyone else in Ontario. But thank you for that question. Sorry for being so upset, but everyone's worked so hard. And again, the healthcare workers are amazing. I'm going to be over there thanking the healthcare workers today.
Follow up?
No doubt, Premier. I'm sure many Ontarians and many people watching this feel the same frustration that you are feeling right now. But I guess a lot of people are probably wondering what can be done to stop something like this from happening. For example, I do see that there are police on scene. I mean, technically, these people would be violating the social and physical distancing
100%.
protocols. So is there a way to ticket people, or what enforcements could the province use to prohibit something like this from happening, and then putting other people at risk, like frontline healthcare workers, who potentially could see some of the people in hospitals if they were to get COVID-19?
Well, I'll leave that up to the police, and I want to thank our police officers across this province. They're absolutely amazing, doing an incredible job, and I support them 1,000%. Again, I don't direct the police. That's going to be up to the police to go out there and deal with this, and I'm sure they will. But they're breaking the law, and I'm sure they'll take care of it. But thank you so much for that question. I appreciate it.
Next question.
Next question comes from Nick Dixon from CTV Toronto. Please go ahead.
Oh, hi, good afternoon, Premier. Thanks for taking my question.
Thank you.
And this may follow up on what Brandon Gomez was just discussing. A Pelham councillor has died from COVID-19. A councillor who had symptoms was at a town council meeting late in March. He also runs a Sobeys in that region as well, and staff there were concerned about the fact that he was, having these symptoms of COVID-19, these respiratory symptoms. It appears the mayor and staff didn't want him at meetings, but he was insisting on showing up. At this point, Niagara Regional Police say no criminal inquiry is necessary. But what do you make of such potentially reckless behavior at a time like this? And do you think that there could be a criminal side to it?
Well, it's terrible what happened. First of all, my heart and prayers go out to the family, and people make mistakes. But folks, please, we've come so far. We're getting there. We're going to slowly open up the economy based on the advice of the chief medical officer. We've done such a great job. We've shown such a united province and a country. Please just hang in there for a little bit. It's going to open. We're going to get the economy going. Again, there's no one who wants the economy open more than I do, but I'm not going to put people at risk. Like these people out in front of Queen's Park, putting people at risk. Again, we'll get there, and we're all working together. The more we work together, which we have been, you see the results. You see positive results of flattening of the curve in the public domain. And the more we do it, the quicker we're going to get the economy going. But please, and vast majority, again, 99.9% of the people are all cooperating. And I appreciate it, and I thank you from the bottom of my heart. And we will get through this. But don't act like the reckless, careless people out in front of Queen's Park right now. We'd be in deep trouble. But thank you for that question.
Follow up?
So then what powers do let's quote unquote say regular employees, people who aren't, the owners of, stores, or who aren't, town councillors, what kind of power do people have to, stop somebody more senior from coming in who appears to have COVID-19 related symptoms? People are afraid about getting exposed to something like this. What can people do? What would you say somebody, in a lower position should be able to do to either stop this or, get somebody to go home or stay away?
Call your public health, and if you really want to shame them, call the local media, because it's just being irresponsible. If you have symptoms, it's like walking around with a loaded gun in your hand. Don't be irresponsible. If you have symptoms, be responsible. Stay at home. It's as simple as that. And again, everyone's listening. Everyone's doing a great job. I've never been more proud to be Premier of Ontario than through this crisis, because we're a team. We're 14.5 million army fighting against this virus, and we're doing a great job as a unit of self-isolating and social distancing. But people have to use common sense and be responsible. And again, vast majority of people are doing that.
Last question.
Thank you.
Last question comes from Wendy Gillis from the Toronto Star. Please go ahead.
Hi there. Good afternoon, Premier and Ministers. I just wanted to ask you about long-term care deaths and the tracking of them. As you know, there has been a big difference in data between the integrated public health information system data and that which is coming out of the Ministry of Long-Term Care. I'm just wondering if you can explain a little bit more about why you have relied for so long on the out-of-date data that until recently you had been using.
I'll pass this over to the Minister of Long-Term Care. Thank you.
Thank you. One of the issues surrounding the difference in the numbers that are being reported has to do with the route they're taking. So for IFAS, the information goes to public health. That data is accumulated and then presented. For our long-term care ministry, we are now getting information straight from the homes and trying to put that together in a more timely way. And so at one point it was the Ministry of Long-Term Care that was slow getting the information. Now apparently we seem to be ahead of that, what's coming through public health. But we're working on closing this gap and making sure that all the information is transparent and getting out as quickly as it can be confirmed.
Follow-up?
Thank you very much.
Do you have a follow-up?
Thanks very much.
Okay. Thank you. Thank you, everyone. Enjoy your weekend. Thank you.